and drop down there. All right, so welcome to tonight's posture workshop. I've got everyone else muted out for the evening so that I'm going to be pausing here and there for them to ask questions as well. But we are going to be recording this so that we'll have the information down, and that way we can share it for people who weren't able to be here this evening. So this is our workshop. My name is Elena here at Marino Physiotherapy. We are located right over off of Cross Park Drive near Cedar Bluff. If you know where the post office is, we're just down on the right-hand side from there. And tonight we're going to be going over about what good posture is, what it isn't, and how to get it without having to work so hard. I know a lot of people have some misconceptions about what good posture is, and we want to try to answer some of those questions this evening. So, you might have heard this phrase before. It's something that came out in, I want to say, the New York Times or Wall Street Journal around 2015, I believe. They put out this article that said, sitting is the new smoking. And if you think about that for a moment, you know, we've spent so much of our lives learning about smoking is bad, smoking is bad, smoking is bad. And smoking is bad. I'm not suggesting you take up smoking by any means. But when we look at the consequences to your overall health, sitting, it's worse for you to sit at a desk job for 8 hours a day than it is to be someone who smokes or someone who works for UPS, you know, hauling boxes and, you know, doing all these things all day long. Sitting has a lot of consequences that we tend to not think about. And if you want to get an idea on that, then, and people ask me, you know, does it even matter? It's just posture. What does it matter? Well, I challenge you to try something with me. Go ahead and slouch down. Okay, get into that awful slouchy posture. And while you're down here, I want you to take a deep breath in. And you notice you don't get a lot of air in there, right? Sit up nice and tall. Lots of that good oxygen that we like. And when people think about, they don't tend to think about how their breathing works together with their posture. Now, they will come to me when a back starts hurting or a neck starts hurting or a shoulder starts hurting, when they have an actual problem, so to speak of. And by that point, then we're having to undo a lot of these problems, whereas with going ahead and starting on having better posture now, you're not having to wait until you get to that point of breakdown to start correcting some of your issues and even preventing future problems. And if you imagine you're someone who just happens to have pneumonia, or right now COVID, if you have something going on that's limiting your breathing, so with pneumonia, you get a germ that gets down into your respiratory system, down in your lungs, and imagine you've got this just infection sitting in your lung, just kind of festering there. And they can give you all this medication and breathing treatments and whatnot, but if you're kind of folded over and you never get the air down or get the mucus up, you're never getting that out, and you're not actually getting to the middle of that ball of festering grossness, infection, to make a difference there. And this is where a lot of people will struggle with pneumonia actually getting better from it. So try that slouching again. Try to do a good cough. Do you think that's going to work anything out? Probably not. But if I'm up here, I can really get some force behind it and get things moving with my lungs. So I see all sorts of problems related to posture, but when people tell me posture doesn't matter, I usually sit and they're like, oh, it won't kill me. We talk about this, and guess what? It can cause so many problems, one of them being an exacerbation of pneumonia and potentially even death. And some of the problems we typically see, and these are just to name a few, let's just go straight down the body of places that get problems because of bad posture. Your head, your neck, your shoulders, your arms, your back, your hips, your knees, your feet. That also includes your ankles, your arches, your big toe. That also includes the upper back, middle back, lower back. That's also going to include everything from your digestion to your respiratory function to your ability for your heart to function normally. I don't know if you know this, but if you slouch down and that breastbone drops down and in, well, your heart is here, and then here's your spine, and here's your sternum. If it's squished down, there's not as much room for your heart to have that excursion and work effectively. Oh, there we are. Decreased heart and lung function. And again, we just tried that out by slouching and trying to breathe. You don't have as much ability to get the air in, to get the air out. And lung function, guess what its job is? Get the air in, get the air out. So those are some things to think about. And something else that we look at, when you think of your posture, your head weighs about as much as a small bowling ball. Okay. If you've ever held a bowling ball, I'm going to turn to the side here. If you've ever held a bowling ball here, it's heavy. But if you hold it way out here, it's a lot harder to hold on to, and it's pulling you forward. Guess what? So if you have that posture where you're leaning forward, it's like you're halfway to falling all the time. So you're going to have an increased risk of falls. Also, if you're not loading your spine appropriately, you're more susceptible to things like osteoporosis. So if you do have a fall, you're much more likely to have a fracture. And I'll tell you, sometimes I have this conversation with high schoolers, and they never think that like the future, oh, that's so far away, I don't have to worry about that. They're not thinking about their spine health at that age. But I will tell you what they do think about. We talked about an even death as an issue with decreased heart and lung function, but these high schoolers, they may not pay attention if I talk about your risk of falls, fractures, death, pain throughout these various areas of the body. But what will get them is this one: awful profile pictures, okay? If you take a picture of a teenager from the side and they look like this, is that a good look for them? No, not particularly. So some of my patients, if they're not paying attention to all of these awful things that go on to your body with bad posture, think of it this way. Do you want someone catching a snapshot of you just looking bad with a forward head and a hanging neck? Versus if I'm up here, that's going to look much better for my side view than here. And we've all had it happen on occasion. Someone takes a picture and you're in the background and you're thinking, who is that person? That can't be me, can it? So one of the things that we look at, if you're not swayed to have better posture by feeling better, at least be swayed by looking better. How about that for an answer? So those are all some of the consequences of poor posture. The reason I talk about this, so a little bit about me. Hi, I'm Dr. Elena Marino. I'm almost done with my second. It's a clinical PhD called a Doctor of Clinical Science. Almost done with my second doctorate. You may notice as I go through here, I have quite a bit of experience. I've been practicing since 2005, got 4 manual therapy certifications. I'm certified in dry needling. I'm a board certified orthopedic specialist, and I have several years of fellowship experience behind me, specifically in being able to get to the root cause of problems with diagnosis and management of a variety of issues. So if you're having pain between your hair and your toenails and that body part moves, chances are it's something that we treat. So if you have questions like, oh, I wonder about this thing or that thing, ask your physical therapist. If you're unsure who to ask, guess what? I have plenty of experience and a lot of extra training to be able to answer those questions for you. Really, if someone asks what I do, I typically tell them over in this right-hand corner, I tell them I'm a body mechanic because I help the body move better. So not the kind you drop off your shoulder on Tuesday and pick it up on Friday and then it's all better, but we do help the body move better. And my background is in advanced biomechanics to be able to help you move better. So one of the things I started noticing early on in my career is how many people had spine problems that went hand in hand with a posture issue. How many people had hip and knee problems that went hand in hand with a posture issue? How many people had shoulder, neck, headaches, these other problems that we kept coming back to, having to also teach those people about their posture. So because we see so much of this involved in these other conditions that we're typically treating, we found that if we just put the information out there for helping with your posture, it can help reduce a lot of these other situations. It can help reduce issues that are not physical therapy related, such as your heart and lung function. Oops. Okay, so back to getting into, I've just seen so many patients that have posture as a component to what they have going on. And so many people who, and of course, I want to look at everything that's going on, but I have so many people that just taking care of their posture takes the stress off of the tissues that are causing the problem and turns their pain off. So if we can start with something very basic and essential to everyday life, that's going to be what really gets us, gets our patients doing well, and not just feeling better, but actually getting better over time. And if we can change some of your posture habits, then over time, you're continuing to unload tissues that really aren't designed to take the load. So yeah, that's how we ended up starting to do these posture talks, and I do them every month. And starting in September, we'll actually start doing them in person again. But just going over it, here's how your spine is supposed to look. Here's how it's supposed to feel, and here's how it's supposed to function. Just learning those basics can take so much of the stress off of the rest of your body. Now, some of the most common causes of poor posture. I'll tell you the number one thing I see right now is this bad boy. Oh, there's my picture of my dog if you were curious. But a cell phone is one, a cell phone or a computer tablet. These are all activities where you have a device. I mean, how does my posture look right now? And you see so many people doing this where they have a device, whether it's a cell phone. Our old school devices were called books. I don't know if you remember those things from way back in the day, but a lot of times people would have a book and they would just be looking down, and that would be how they would read. And look at, if you imagine my head's that bowling ball again, what does it look like here? That probably doesn't look so great, does it? So devices are going to be one of the biggest culprits to you having poor posture. Now, another thing that we see is people driving. So the next time you're at the intersection over here at Cedar Bluff and North Peters, it's a big intersection, there's cars all around you. I want you to turn and look at the car next to you. And what is the driver doing? Unfortunately, now we're seeing this with the cell phone looking down, or you might see people here, because we have those bucket seats in cars that tend to be like lazy boy chairs. And what they do is they have your bum down here and they're kind of curved. Even if it has lumbar support, it still kind of pushes you forward. So how many people do you think would look like this in the car? Or sometimes we have people like reach in the back seat trying to, you know, swat at a kid, not swat, but hand something to a child. So there's all sorts of different postures people are going to be at in a car. And typically this is the one we see where that head is forward and the arms are up here. So just the simple act of driving, or think about your seat at work or at your desk or where a place you're at a computer. And I love this little picture of this guy because that's what so many people look like. When you have something in front of you that you're focusing on for a prolonged amount of time, your tendency is for the head to come forward, to it's almost like as you look at something, you tend to lean towards it. So something to think about, your desk setup is going to be very important. If you have a desk setup that folds you over and you feel like you're on a little bitty laptop, you know, little typing and curled up to try to get your head to that, that's going to be a problem. So the next thing that we look at, we know the most common causes of posture. Now let's look at some ways we can actually address it and start changing it. So what we're going to go over are a couple of lessons about the spine. And lesson number one, bones are hard. Okay, most people look at me and they're like, Elena, have you lost your mind? I know bones are hard. There we go. Okay, I'm going to pull this up so hopefully you can see what we're looking at here. This little piece of spine, this is my little friend Skinny. Okay, this is Skinny. Skinny is a spine, and if you'll notice, here we go. If you'll notice on Skinny here, we see all this white stuff and the pelvis. All right, now the pelvis and this white stuff, this bone is hard. And most people are like, whoopity-doo, Elena, I know that bones are hard. Why does that matter? Well, when we look at the bones of your body, we look at the bones as the load-bearing support structure. So just like in a building, you want the weight to go through the support beams, not through the drywall. In your body, you want the weight to go through the skeleton, not through the muscles, ligaments, tendons, nerves, skin, hair, fascia, eyeballs, organs. All of these other tissues have a function, but it's not to hold up the weight of the body. So you might have heard at some point in the past where someone said, sit up straight, or stick your chest out and pull your shoulders back, or imagine there's a string pulling your head up. That's not good posture. Good posture is not about holding it up and sticking the chest out. It's about putting the least amount of stress through the fewest amount of structures and still being able to do your day-to-day activities. So if you notice, so lesson number 1, bones are hard. Real exciting, right? Let's see. Our next slide over here is going to be, next up, lesson 2. The spine is essentially just a stack of blocks. Now, when we look at the spine itself, we have to look at everything involved. You know, we have the little joints, we have muscles, ligaments, nerves, fascia, we've got the bones, and we've got the discs. All of these make up the spine, and it can seem pretty complicated, but in reality, it is just a stack of blocks. So here we go. I got a stack of blocks. Real exciting. These are just regular old little kids building blocks. And what I want you to notice on the stack of blocks here, okay, it's not perfectly stacked, all right? So this stack of blocks, even though it's not perfect, I can push down on it and it's still very strong. It doesn't have to be a perfect spine to still be a very strong and stable thing. And what I want you to notice in the stack of blocks is, are they working hard to stay upright? No. What they're doing is each block is just resting on the block beneath it. So if the bottom block is level, the rest of the blocks will just stack. Gravity is allowing each block to rest on the block beneath it. Okay? So that's what we're going to be teaching you to do with your posture today, is not to have perfect posture and sit up straight and pull your shoulders back, but how to stack your spine so that it just rests. Okay, now I'm going to grab a couple of things to set up so you can see this next part, and we're going to go over how to stack your blocks. Yes, so our last lesson is going to be about the bony butt bones. And I'm going to set this up so that you can see what I'm doing. All right, so lesson 3, the bony butt bones are at the bottom of your spine. So if we go back to looking at skinny here, all right, so this is the pelvis, the bottom of the spine. Right here, that little socket is part of the ball and socket joint of the hip. So if I was sitting, then my knees would be over here, and this would be the thigh bone. And right under here, well, have you ever had a little kid sit on your lap before? And you're like, oh, they have those bony little butt bones. Guess what? We still have them. So that's what we're going to do next, is find your bony butt bones. And, okay. I'm going to be adjusting the screen for just a moment so that hopefully you can see everything we're working on. All right. A little bit lower. I can do some cool things with bodies, but technology takes me a moment sometimes. Okay. I'm going to back up over here, and I'll speak up so you can hear me. So when we look at good posture, if you notice, I'm just there. Does it look like I'm working hard for my posture? No, because I'm lazy. I'm busy thinking about you and about my paperwork and about what I'm going to have for dinner tonight. I've got other things going on in my mind. So I can't expect for everyone else to be thinking posture, posture, posture all day long. It's just not feasible. And like I said, I do this for a living, and I don't have time to think about posture all day long. So what we're going to look at is not how to have good posture. We're going to look at how to have easy posture. We're going to look at how to stack the blocks so that I can just set it and forget it. Okay, I'm not looking to have perfect posture. I'm looking to have unloaded and safe posture. So we're going to treat your posture kind of like a crock pot. You turn it on and then you're good to go. You shouldn't have to think about it for a while. So the way we're going to do that is I've got my feet on the floor, and I'm going to take my hands and slide them down the side seam of my shirt, reaching around under my bum. Okay, give that a try. And I still have my feet on the floor. What I'm going to do next is take my belly and stick it out and slouch it down. Stick it out and slouch it down. Now, as I stick my belly out, a lot of people would say, oh, look at that good posture. No, that's just hard. but I want you to notice what your bony butt bones are doing. When I sit super tall, I'm essentially feeling the back of my thigh. And as I slouch, now I'm feeling bunts of steel. No, I'm working on the steel part, but I'm feeling more of my butt. But in that middle zone, when I can find that spot where the butt bones are the boniest and the heaviest, I'm going to stop there, take my hands out, and I'm just going to let the weight of my head stack the blocks of my neck, blocks of my back, through the blocks of my bum, and just rest. Again, I'm just stacking the blocks. I'm letting gravity do the work here. I'm not trying to hold my chest up. I'm not trying to pull my shoulders back. I'm just finding neutral and resting. Okay? Now, let's go over a little trick here. You may notice that as I'm sitting, my knees right now are about level with my hips. That's doable, but if you're someone who sits at a desk for any amount of time, over time you're going to find yourself doing this and just kind of hanging out. So even though you may have seen a good posture handout at some point that said you're supposed to sit at 90, 90, 90 for your posture, in reality what we want to look at is if you can lift your seat up a little bit so that your knees are lower than your hips. Getting your knees lower than your hips, I want you to watch what happens as my knees come up. Do you see how that tends to fold me over? Versus if my knees are lower, it's much easier to rest on those bony butt bones. Okay, so knees a little bit lower. If I were to put a rolling pin on my lap, then it would start to slide down. Having my knees lower than my hips makes it much easier for me to just stack. And then it's easier for me to rest on my butt bones or my butt shelf. Now, those of you who know what a butt looks like, which I'm sure we've all seen one before, if you imagine, let me come back here. So we would expect that your bottom should have a little curve to it, and underneath it, right, here we go, right there, I call it your butt shelf. It's kind of the underside of the curve where you can kind of rest. So if your knees are lower than your hips, it's easier to rest on the shelf instead of trying to always be rolling around and finding where that neutral position is. So we've got the bony butt bones, my knees are lower than my hips, and I can just rest. Real exciting, isn't it? Now, I want you to think about a couple of things. If you look at my feet, I may have one knee lower and my heel may be up. This, resting on my tippy toes, that doesn't count. Putting my feet up on the stool, that doesn't count. I want to have my feet on the floor, and it's okay if my heel is up a little bit, but I don't want them out here. I want to have my knees, or have my feet generally kind of underneath me. If my feet are on the ground, then my feet are supporting the lower half of my body, and then my pelvis or my bony butt bones are supporting the upper half of my body. Okay, so I think we have a couple of extra tips on here to help you out as well. Let me make sure I'll have them on my screen. And, oh, I lost my full screen. Let's head on back. Okay, so now let's talk about how to make this stick. A lot of times people think that good posture has to be perfect all the time. And in reality, that's not the case. There we go. So what we look at for your spine, let's have a couple of reminders. Oh, we just went over how to use the bony butt bones. And if I don't knock the laptop over here, there we go. All right, so what we look for next, I want you to think about your posture kind of like you would any other diet program, okay? If you spend more of your time eating chocolate cake versus broccoli, well, it doesn't mean you can't ever have chocolate cake. You probably should be eating more broccoli though. When you think of the spine, people say, well, what about if I just want to watch a movie and I don't want to be getting up and down all the time? Guess what? It's okay to do that sometimes, but if you're doing it every single day, or if you're spending hours at a time sitting, well, sitting is kind of like spine chocolate cake. Standing, just doing that little bit of up and down, is more like your spine broccoli. So are you doing more spine chocolate cake or more spine broccoli? The spine is designed to move. It is supposed to move through all different directions of motion. We just don't want to leave it in one direction all the time. So here's the key. you need to unsit every 15 minutes. Okay, I know that sounds weird. Unsitting. What does unsitting mean? It means get off of your bum and stand up. And we're going to go over the way that you do that, because if you have good, strong hips or a nice, strong bottom, those are going to be the muscles that are going to support both your posture as well as taking the stress off of all of those other tissues we spoke of. So the way that you stand up, there's 3 keys to how to stand up safely. And here they are. The goal of standing up, so if I'm over here sitting, if my feet are out here in front of me, well, the goal of standing is to get my body above my feet. Well, if my feet, you know, it might be easier to see if I turn the rest of the lights on here. So the goal of standing is to get my body above my feet. So if my feet are out here, I'm having to haul my body weight up in order to get to standing, which is a lot of stress and a lot of strain. Instead, if I have my feet back underneath me, it's much easier. Now, if I'm sitting way back in the seat, my feet can't come very close underneath me, can they? So here are the steps to how to safely stand up from a chair. 1, scoot up to the edge. 2, get your feet back underneath your bum. 3, you're going to look up as if you're looking at a clock on the wall. You're going to look up as you stand up. Now, if I've gotten my feet back underneath me, so scoot up, feet under butt, then when I look up to stand up, I'm not having to haul my body weight forward. I've got my feet underneath me. I look up. I'm just rising straight up. Now, if I told you the secret to doing this well was to do 50 squats every single day, you'd probably think, oh, I can't be doing 50 squats a day. That's just way too much. Or my knees might hurt, or my hips might not take it. Guess what? How many times a day do you stand up and sit down? All right. Up and down from the toilet seat, up and down from the breakfast table, up and down from the toilet seat, up and down from a couch, up and down from a car seat, up and down from the chair at the doctor's office, up and down from your desk seat, up and down from lunch, up and down from getting back from the lunch table, up and down from the bathroom again. You're up and down all day long. So guess what? When I look up to stand up, I'm essentially doing a squat. When I sit back down, I'm gonna stick my booty out the back. And as I slowly sit back down, you notice this is all a squat is when you sit down and stand up. Now, you'll see people doing workouts where they go into a much deeper squat, which is fantastic. But to begin with, if you can just take something that's not great for you in general, which if this is how I get up, hauling my body weight up, and then trying to get back up to get moving, that's not great for your spine. If you can take something that you're going to do anyways in your day-to-day habits and turn it into something that's great for you, it's like a +2. You're taking something that's bad for you and transitioning into something that's great for you. Looking up to stand up. It's going to get you stronger. Within about 2 weeks, you're going to get stronger in your hips and thighs. It's not that you're truly stronger. It's just that you're more efficient at using the muscles that you already have. Then at about 4 to 6 weeks, you're actually going to start developing new muscle tissue. So I help teach a class called Aging with Independence. And people say, Elena, what is the secret to aging with independence? I don't want to live in one of those nursing home places. And you know what I tell them the secret is? Are you listening? This one's a good one. The secret to aging with independence, or aging in place, being able to live in your own home, doing what you want to do when you want to do it, and go in your sleep one day, is going to be, drum roll, a perkier butt. And people laugh at me when I say that. But if you're in the hospital, before you go home, they're going to call someone like me in and say, hey, Elena, is Miss So-and-so safe to go home? And I'll say, I don't know, let me check. And I'll walk in and I'll be like, hey, Miss Smith, let's go for a walk. And if this is Miss Smith trying to get up, give me your hand, help me up. Is that person probably going to be safe at home? If they can't get in and out of a chair safely, then how are they going to be able to safely make it to the bathroom in time? How are they going to be able to safely get out of the house if there's an emergency? These are the safety things we've got to keep in mind. Now, if I walk into that same room and I say, hey, Miss Smith, let's go for a walk. Miss Smith scoots up, gets her feet under her butt, and looks up to stand up and says, where are we going? Let's go. Guess what? Miss Smith is on her way back home. Miss Smith that can't get up and down from a chair on her own is probably looking at a skilled care or rehab situation where they're not able to do what they want when they want on their own terms. That's where you're looking at a hospitalization or a skilled nursing facility or something along those lines. So, secret to aging with independence, the secret to better posture, the secret to having less issues in your neck, shoulders, upper back, middle back, lower back, hips, knees, ankles, feet, big toes, headaches, the secret to taking a lot of the pressure off of some of these body parts is simply being stronger in your butt. And the easiest way to do that is to take your daily habits, instead of having to do 100 exercises a day, take your daily habits and turn them into something that's going to be good for you. And it's as simple as looking at the clock on the wall, looking up as you stand up. So that doesn't seem too difficult, does it? I hope you've given that a try for the standing up and sitting down. Let's scoot on to back to our PowerPoint presentation. So again, one of the things people always ask me, is sitting really that bad for me? And usually what I let them know is it's not really terrible, but the problem becomes when you are chronically sitting, meaning you're sitting for like 20 to 30 minutes at a time without moving. And whenever I say this, most people are like, oh, I watched like 4 episodes of a Netflix show and I sat for like 3 hours straight the other night. That's not great for us. And it's a pretty recent development in human history that we're going to take our evening and sit still for hours at a time. And you may be kind of comfy in that lazy boy chair, that couch, but I want you to think about, what does your posture look like? Okay, I want you to think about, what is that chair that everyone, a lot of times you go into someone's house and like, oh, that's mom's chair. Like, that's where mom sits. Don't mess with mom's chair, or don't mess with dad's chair. And I want you to imagine that you're comfy in that chair, and then someone comes along and takes some hairspray and sprays you down, and you're stuck in that position. What are you going to look like when you stand up? You're probably going to look like this, right? That's not a good look for most people. So, something to be thinking about. The positions that you stay in for a long amount of time tend to be the positions you get stuck in. Did your mom ever tell you, like, if you crossed your eyes too long, that they would get stuck that way? My mom said the same thing. Now, I've never seen it happen to eyeballs, but I have seen it happen to pretty much every other body part. If you sit in a slouched position for hours at a time and then stand up and expect to have this beautiful posture, it's not going to happen. That's where people get this hump. Right here, it's called a dowager's hump. If your head's like sticking out forward, it's not like you just woke up one day and, poof, now you have a hump. It comes on over time, and it has to do with your head being forward and your shoulders being forward. So I hope that was useful information. The next thing we're going to cover is about how your shoulders are involved with your posture as well. Let me check. All right. So when we look at your shoulders, I'm going to get the hang of this computer. So I want you to notice when we look right here, all right, on my shoulder, if I've got good posture, I can move this arm around and it's no big deal. But if I slouch, I don't know if you can see that little angulation right there, and I go to reach my arm, can you see how all the weight of my arm is now going through this muscle right on top versus my shoulders down? It's no big deal. Shoulder forward, head forward, either or both of those happening, I'm going to shift all the weight of my arm, through this muscle, and it's going to pull on my neck. So this is where a lot of people will tell me, oh, suddenly my head's forward, and it's like I always have these knots in my shoulder. You didn't just wake up one day like, hey, let's put knots in the shoulder. What happens is if you're continuing to put stress through that muscle and pulling on the neck, those muscles are not getting knots in them. They're just hanging on for dear life to keep your head up and keep your shoulders up. So think about that. If my head is forward and shoulders forward, I'm putting a lot of stress through those traps and pulling on my neck. If my head is back and my shoulders are back, look, that doesn't look too stressful at all, does it? It takes the stress right off of those. So when people tell me I store my stress right here, I have all this stress right here. Now, if you have a stressful situation, your natural tendency is to kind of move towards a fetal position. Yeah, that can affect that as well. But what we're really looking at here is the chronic positions that your head and shoulders tend to be in. Now, let's go over, excuse me. So you might have remembered the very first slide we talked about things that tend to hurt. Do you have pain with your, I might have unclicked a button there. Okay, so you might have noticed that sometimes when things are hurting, you wonder, like, is there anything I can actually do about this pain? Well, yes, and here's the way you can tell if there's something you can do about your pain. All right, you're wondering, can I actually get some pain relief in my spine, in my shoulders? You know, is this posture, yeah, I've tried to fix this posture, but it still hurts. Is there a way I can get relief? Here's the easy way to tell if you can get relief. Is your pain reproducible? Is there an activity that you do that you know is going to start making you uncomfortable or painful? If I lift a heavy box, if I pick up my grandkids, if I sit like in the car too long, if I sit in front of the computer too long, if I'm on my computer or reading a book too much, if I'm doing the dishes where I'm lean with my arms forward, my head down, are there activities that reproduce your pain? Or if I turn my head a certain way, or if I turn my spine or lean a certain way, if you have an activity that reproduces your pain, that is fantastic. Because if your pain is reproducible, it is reducible. Okay? Let's say that again. If your pain is reproducible, it is generally reducible. Because if we have that mechanical direction that every time we do something, this is what hurts, we know that that's something that we can start to fix. So if you're wondering, when do I actually get help? If getting to that neutral position for your posture and resting there, if that's uncomfortable, it means something's probably not moving well and you need someone to get in and assess where the problem is and teach you how to fix it. If you notice that in the last, well, I want you to ask yourself, in the last 30 days, how bad was your discomfort? Okay, was it like a 1 or a 2, or was it like a 5 or 6 or even a 7 or an 8? If your discomfort was in those higher numbers, then that's when you probably need to be getting assistance. I tell people if your discomfort is higher than a 4 for more than a couple of days, you need to see somebody because your body is sending a little alarm that say, hey, there's something going on here. You got to check it out. Now, so be thinking, when do you have discomfort? We talked a little bit about these. Oh, and I'm sorry, for some reason, my presentation is not sticking with me today. Again, using your computer or cell phone device when you're doing your job, maybe you're cleaning up around the house, driving, sitting, using a cell phone or a tablet. Those are the most common things that we see people have go on that'll give them some pain. And I'll tell you, they may be thinking, oh, I'm just sore because I was doing that activity too long. Well, let me tell you what the number one single biggest mistake that people make when it comes to pain in their body. It's going to be this first one. They ignore it. They pretend like there's not a problem there. So ultimately, there's only 3 things you can do when your body's hurting. You can ignore it. You can just say, oh, I can handle it, or I'll just take some more Advil, or I can just sort of get by without it, or it's not that big a deal, or it's just normal for my age. I'm just going to deal with it. And they just sort of move on and ignore it. The next option that people have is to alter it. This usually comes in the form of addictive medications, painful injections, or expensive and often ineffective surgeries. So if someone with bad posture comes in and says, you know what, my back is killing me, and they never try to fix the underlying postural problem, they go straight to what? They go to the doctor, and the doctor says, oh, you've got back pain, here's some pain medicine. Here you go. And it's not like a lot of the overdoses we're seeing now are not from junkies on the street that we used to think of in the 80s with the Just Say No campaigns. These are just good people who are trying to find some help with the pain that they're in. And when you have a medical physician tell you, here's some medication, then you think it must be safe, it must be okay, because the doctor told me to. Well, those medications are only supposed to be used for, a couple days max. For people who use them more than 5 days, we know that you have a 1 in 4 chance of becoming addicted to those medications. When you take away people who've just recently had a surgery, because a lot of times they'll put them on those medications for a few days after surgery. If you take away people who have just recently had a surgery within the last week, of the people who are left that take pain medications for more than 5 days, you're looking at a 1 in 3 chance of being addicted to those medications. That's not a fun road to go down. And here's something I want you to think about. With these medications and injections, those are masks. It's just a way to dull the pain. It's not addressing the actual underlying problem. So if you have questions about this, feel free to reach out to me, but altering your pain with addictive medications, painful injections, or expensive and often ineffective surgeries, it's really sad when you see someone go all the way through having a surgery and they didn't actually address the problem and they're back in that same amount of pain within 6 months to a year. Altering it is an option you have. It's not the one I would recommend though, for the reasons we just spoke about. Or you can handle it. You can call your friendly neighborhood PT and get an assessment to find out exactly what is going on. So let's talk about what that looks like. So successful, non-invasive treatment for whether you have pain or postural dysfunction or something on you isn't moving the way it's supposed to be. Well, the number one most important thing that you need when you come in for physical therapy, notice it's not exercise. Now, exercise is great for you. A lot of people can just get a little bit of exercise in, it pumps up those endorphins and their pain just turns right off, which is fantastic. But ultimately, when we're looking through someone having a pain or a problem, the most important thing to do is to have a thorough and precise assessment. Because if you don't know what the problem is, how are you going to effectively treat it? So that getting to the root cause of what your problems are is going to be the most important part there. Next, we look at someone getting their hands on you, checking those joints out and seeing, okay, is this how this is supposed to move? All right, is this gliding the way it's supposed to? And if it's not, getting in there and getting it moving, getting those joints and tissues moving in the correct direction. Again, it's not just movement, but it's the correct movement in the correct direction is so beneficial to start turning off a lot of that pain. And finally, once you get moving appropriately and you've turned the pain off, then strengthening and stabilization exercises are great to maintain what you need. Now, a lot of times we have people that go through this process and they're like, oh, Elena, I watched your video and I worked on my posture and it was good, but I just started getting really tired in between my shoulder blades trying to stay upright. Guess what? There's probably an issue in the upper back or the ribs. They come in, we get our hands on there, get that rib moving the way it's supposed to be or whatever the underlying cause is, and then teach them a couple of breathing exercises or teaching them, okay, you're going to do this one motion to keep that rib moving. And you're going to do that, lift the arm in that way 3 times a day for the next 4 days. And that's all that they need. Then they're able to start getting into that good posture habit where they can rest and relax into a safe posture, as opposed to trying to just exercise through the pain. If you can go through that appropriate process, you can make it a very easy and minimize the discomfort type of process. Now, so you got to ask yourself, what are you going to do? Are you going to change your posture? Or are you going to just live in pain? Again, you have the 3 options. There's 3 of them. You can ignore it. I love that little picture of the monkey, but I hate what he stands for because ignoring it, well, things don't just go away on their own. They may start to feel better, but again, an absence of pain does not mean an absence of problem. If you still have that funky posture, you're going to have problems catch up to you down the road. So you can ignore it. You can alter it with addictive medications, painful injections, or expensive and often ineffective surgeries, or, my decision of choice. Ultimately, it's your body. You're going to have to decide what you want to do for yourself, but getting a handle on it, getting to the root cause of what is causing your pain and learning how to settle that is ultimately going to be your best next step. Now, a lot of you on here, we don't advertise our posture workshops a whole lot. So most of you on here are probably current patients, or you've been a patient in the past, or you've got a friend who's a patient. For those people who aren't already patients, we do offer, for anyone who's gone through and done one of our workshops, when we talk about handling it and they're not sure, like, is it something they even need physical therapy for, we actually offer a free screen. So anyone who's been through one of our workshops, it's just a 20-minute one-on-one session with one of our physical therapy specialists to take a look at you, listen to what your issues are that are going on, and help you find, identify a cause of your problem and what correcting it would look like. And I will tell you right now, we do offer for patient evaluations. So that's covered by insurance. We actually look over how you're moving and help you start to move better. because of COVID, we are able to offer telehealth visits now too. So our screens are in person here in the clinic if you're here in the Knoxville area. For those of you who are here in Tennessee, we are able to do those telehealth sessions where if we need to, and that's covered by, again, most insurances, but that's where we would do a Zoom session like this to be able to have a conversation, see how you move, and go over, okay, here are the things you need to be working on. So safety is going to be our priority. So if you are someone who's at high risk, or again, if you've been sick recently or around someone who's sick or are COVID positive or have been around someone who's COVID positive, we ask that you don't bring that to the clinic, but we do have options to be able to do this over the phone and over video chat. So again, our phone number is on there, 236-0340. Feel free to call or text us if that's something that you would like to set up a free screen. And I'd like to take this time and kind of open it up for any questions that you all might have. And let's see. I'm actually going to kind of go through the rest of this, and in that way I'll be able to, for those of you asking questions, we are recording this. I'll be able to stop the recording. So if you have questions about your own condition, we're not sharing any health information there that we're not supposed to. So I hope that you found this information helpful for our posture workshop today. Again, you're welcome to go through our website, marinophysio.com, and request an appointment time if you do want to set up an appointment. If you've got just one thing you want us to do, like, hey, is this something PT can help? The free screen is great. If you have, like, maybe it's my neck and my shoulder or my neck and my back, those are times it's probably better to go ahead and just do the full hour-long evaluation for us to be able to get our hands on. Go ahead and start getting you feeling better. So again, the way you set that up, you can call and text us, call or text us at our main line, or go through our website. And if you did find this information helpful, I would highly encourage you to go on Facebook and leave us a 5-star review, or go on Google and leave us a 5-star review. A lot of people who are looking for the services that we have to offer, or who are wondering, like, should I attend their workshop? I'm not sure about this workshop business. They go on and they look us up on Google and they say, well, what are they about? And are they good people to be learning from? So if you found this information useful, we'd very much appreciate you going on to Google and Google Marino Physiotherapy, and we'll pop right up. You can click on the little map and click on the little stars, and it'll let you leave a review for us. So I hope you found that information helpful. And we're going to take a few minutes for those of you who are here in person to answer any questions that you might have as soon as I figure out how to turn that back on. Here we go. Let me in. Let's show participants here. Here we go. All right, so I see we've got Elizabeth on here. I'm not sure if Carolyn was able to make it on, but Elizabeth, do you have any questions about anything that we went over? You might have to unclick your mute button.
Can you hear me now?
Yes,
okay.
Yes.
Thanks for the reminder. I have a comment. I particularly like the way you explained the stacking of the blocks, you know, and how each block doesn't have to be in perfect symmetry, you know, with the one above it or below it for it to still do its job, you know. So I'm going to be thinking about that because because I'm trying to improve my posture right now to decrease my shoulder pain, you know, and I have a tendency to hyperextend my shoulders too far back, and then you know, it's like I'm overkilling it.
We see people do this a lot.
Yes.
Now, does my head look like it's above my body?
Yes, and so that's really going to be helpful, you know, with me, for me to remember those blocks and how, you know, and not my, I call it my mud turtle posture when I throw my head too far forward. Yes.
Well, that's excellent.
Yeah.
And I'll tell you, it takes a little bit of practice to get the hang of finding those bony butt bones. But ultimately, if we can get that top block, your head balanced above the rest of the blocks, the rest of it becomes so much easier. And even with people whose posture changes over time, everyone always says, how does my posture look? And my first question is not how does it look? How does it feel? Does it feel like you're stacked, or does it feel like hanging on the muscles and ligaments? Does it
Right.
feel like it's easy, or does it feel like you're working hard for it? So those are some great points that should help you out.
One other question I have is there an ideal sleep posture that is beneficial to, for a good therapeutic rest and sleep, where your spine and everything can rejuvenate itself to face the next day and all? Is there an ideal sleep posture?
There are, and it's a little bit different for everybody. So it's interesting where I have some people who will feel like they need 3 pillows. And in reality, what do you think that pillow is doing to your head?
Throwing it forward.
And if you sleep like this all night, how do you think your breathing is going to be?
Compromised.
And what do you think your spouse is going to hear? They'll hear that snoring, right? Part of that has
Well,
to
that'll be my cat, Molly Rose. I live alone.
well, Molly Rose might give you a look.
Yeah.
So some of that can affect your breathing. So I generally tell people go with the flattest pillow that you can comfortably rest on. When you're laying back, if your head does this to hit the bed, you probably need a little pillow. You want to generally have your nose hole to ear hole kind of stacked above each other. Not this way, but just straight up and down. So if you sleep on your back, that's a helpful thing. I'll tell you, for me, I have a pretty flat pillow that I'll squish when I lay on my side because I'm a side sleeper. But if I do feel the need to lay on my back, I'll actually take a hand towel and roll it up until it's about the width of the middle of my forearm, about that big around. And then I'll lay that back right across the back of my neck. And it gives just that little bit of support. And I have a lot of people who will either use just that towel roll, or they will, if you imagine, here's the pillow, and then here's the pillowcase. They'll put that roll next to the pillow inside the pillowcase to give them a little bit of support. And that's nice for you if you're a back sleeper or a side sleeper. It shouldn't be too big. It should be, again, just about on your forearm, about that big around. So if you have a big forearm, you probably have more of a neck to work with. If you're a small person, then that's probably closer to a small roll. So you're just rolling it up until it's about the width of your forearm. For a lot of people, that's the size of a small fun noodle. So they'll just stick a fun noodle in their pillow and get a little help there. Now, when we look at the spine, a lot of times people have like here, and then they have a wig, and it comes back out to your hips. So when you lay on your side, sometimes putting that same little roll under your waist will keep you from the waist sinking down into the bed, and then you having this big kink in the side. So those are a couple of things you can look at with your posture. Most important part, so when you're upright, you have gravity pulling on your body. When you're sleeping, you're pretty much gravity eliminated. Then you can just rest. So if you're comfortable when you sleep and you breathe well and you wake up feeling refreshed, then that sleeping posture is just fine. There's nothing that says you have to sleep in a certain way. The main part about sleeping well is that you actually get some sleep. Does that make sense?
Yes, absolutely. Thank you, Elena.
Yeah, no problem. Anything else you had questions about?
I don't think so, but I want to